Oh, I don't know, it's not gone. I'd like to show you that in previous GDM women they present a high prevalence of urinary incontinence 2 years after C-section. In the translation studies, after these results, we showed that the pelvic floor muscles from diabetic pregnant rats showed an alteration of the rest fast to slow relation, as well as the collagen composition. Based on these previous results, we decided to study the effect of DDM on pelvic floor muscle function using the 3D ultrasound. I am the Rude. We are present. This paper was developed in Brazil, and this is my university, Unesp, with financial support from FAPESP. The aim of this study was to investigate the effect of DDM on pelvic floor muscle, either contractility or distensibility at 2 time points of pregnancy by transperineal 3D ultrasound. The study design, we decided to study the functional evaluation of pelvic floor muscle at 24 weeks of gestation. That is the moment to make the DDM diagnosis, and at 36 to 40 included the treatment of these patients. We use a transperineal ultrasound. Here you have the image, the 3D image at rest, here at the distension, and here at the contraction. The results of our studies showed that we have a gestational progress of the elevator higher tall dimensions between GDM and no GDM group. At 24 weeks of gestation, we can see that the pelvic floor muscle from GDM women has less conditions to contract, as well as at the end of pregnancy, the same was observed. So that means that the muscles does not have conditions to contract, and so the higher tall area is higher. During the distension, the pelvic floor muscle distension, we could see that the non-GDM group, the pelvic floor muscle dysfunction, pelvic floor muscle distension increased at the end of pregnancy, showing what we really physiologically expected to increase the possibility to normal delivery. But in pelvic floor muscle from GDM women, we have a decrease from 24 to the end of pregnancy, showing that we have a muscle that has no conditions to distend. The analysis of our results lead us to conclude that a newsworthy finding. That means DDM has a negative impact on pelvic floor muscle, either on contractility as well as on distensibility. Show for us that at 24 weeks of gestation, the pelvic floor muscle from diabetic women is a weak muscle, and at the distension is a soft muscle. But at 30 weeks of gestation, the pelvic floor muscles from diabetic women continues to be a weak muscles, but at the distension show that we are in front of a muscle, a stiff muscles. Thank you very much.
Thank you.
Thank you very much for this presentation. Other questions, please, and comments?
Hi.
I'm sorry. Please, go ahead.
Mariana Masling from the University of Michigan. I have a question. Do you have any data about the labor outcomes of these women?
We have all these patients, because we are doing a cohort from these patients. We are now at the delivery. So all the patients are submitted to C-section by different results, by different conditions or indications.
Okay, thank you.
Magdi Hassuna, University of Toronto. Have you looked at those patients after delivery and see if the correlation of your ultrasound coincide with their voiding pattern?
We are doing this now because we are at more than 7 years ago. We are surprisingly with the results with more than 15% of our previous GDM showed a high, more than 15% of urinary incontinence 2 years after delivery. So we are now following these patients during pregnancy until 1 and 2 years after C-section.
Christopher Hong, United States. Thank you so much for the nice presentation. I was wondering if you were able to look at some of the risk factors predisposing women in each of the groups to GDM and whether or not any of those had an impact on the levator area. And secondly, I was wondering if you took a look at the gestational size of the fetuses, because certainly for women with GDM, you would have an increased risk of having a larger gestational size baby, and perhaps that may also have an impact on the measurement of your levator area.
Okay, we have a special center to take care of these pregnant women. We have diabetic center related to take care with strict control during pregnancy. So our large for gestational age as well as macrosomic infants are not significantly different from the non-GDM. Of course, when you look the number, there are high incidents, but not significantly different. The second one is?
For risk factors, certainly for women with poor nutrition, predisposed to developing GDM, and perhaps that may also be a factor leading to pelvic floor dysfunction. I'm wondering if you took a look at that at all.
Quite all these patients are part of our public health system, but we are now including patients from the normal assistance. Normal medical assistance.
Thank you.
Richard Millard, Sydney. Are you postulating that gestational diabetes has a neuropathic effect on the pelvic floor, or have you considered that the stiffening, the failure, the stiff muscles are actually due to a reduction in relaxin levels in diabetics? Did you look at relaxin levels? Are they changed in these two groups?
We are in translational studies. We demonstrate that the collagen relation between collagen 1 and 3 are altered, similar that what we have in aorta, in arteriosclerosis. So we are now in the new studies looking and having the biopsy of hiatus abdominis muscles, and we are looking for this. In a small one result that we are presenting here as a poster, we don't have all the results. We showed that there is the same alteration in the hiatus abdominis muscles in terms of collagen relation 1 to 3. Probably this is the real cause. I don't know yet to answer your question, but I believe in it, and we are looking for this.
Secondly, is there a correlation between what you've shown differences in the pelvic floor stiffness and the difficulty of vaginal delivery and an increase in perhaps tears and damage to the pelvic floor during vaginal delivery?
I believe in that, because we have a great difficulty to induce vaginal delivery in this population. There is a high incidence of C-section when we decided that now the baby needs to be born. So we have difficulty to have the success in this induction. Probably the same, as GDM is full disease. It's not only related to pelvic floor muscles.